Protein has become one of the most talked about nutrients in mainstream health and nutrition conversations. Social media is full of high-protein recipes and protein-fortified versions of everyday foods. Cafes are now offering protein lattes. Fitness communities debate optimal intake numbers with the same intensity once reserved for calorie counts. In the middle of all this noise, a simple and important question often gets lost. How much protein does your body actually need, and how do you figure that out for yourself? The answer is more nuanced than most popular content suggests, and getting it right matters more than most people realize. What protein actually does in the body? Protein is classified as an essential macronutrient, meaning the body needs it in large amounts every day to function. It is the primary building block of muscle tissue, but its role extends far beyond muscle. Protein forms all types of cells in the body. It is required for immune function, producing the antibodies that respond to infection. It makes up the enzymes that drive virtually every metabolic reaction. It contributes to hormone production and hormonal signaling. It supports bone and joint health. It is involved in the regulation of body weight through its effects on satiety and metabolism. In short, protein is not a fitness supplement. It is a foundational biological necessity that every body relies on continuously. The standard recommendation and its limits. The most commonly cited protein guideline is 0.8 grams of protein per kilogram of body weight per day. To calculate this for yourself, divide your weight in pounds by 2.205 to get your weight in kilograms. Then multiply that number by 0.8. The result is your estimated minimum daily protein requirement in grams. For a 150-pound person, this works out to roughly 55 grams of protein per day. For a 200-pound person, approximately 73 grams. These numbers represent the minimum to avoid deficiency in a relatively sedentary healthy adult, not necessarily the amount that supports optimal health, active recovery, or muscle maintenance over time. The critical word in that formula is minimum. The 0.8 grams per kilogram figure was established to prevent protein deficiency in the general population, not to optimize health outcomes across diverse individuals with different activity levels, life stages, and physiological demands. Using it as the ceiling for protein intake, rather than the floor, is one of the most common misunderstandings in everyday nutrition. Factors that change your actual needs. Several factors push protein requirements meaningfully above the baseline, and for many people, more than one of these applies simultaneously. Age is among the most significant. The body's efficiency at using protein to build and repair muscle tissue declines with age, a process that accelerates after approximately 60. Older adults generally need more protein per kilogram of body weight than younger adults to achieve the same anabolic response, meaning the same muscle building and maintenance effect. Research in this area supports intakes closer to 1.2 to 1.6 grams per kilogram daily for older adults, particularly those who are physically active. Activity level, and especially the type of activity, significantly affects protein needs. Endurance athletes, strength trainers, and people with physically demanding jobs all require more protein to repair exercise-induced muscle damage and support adaptation. Even people who are highly active in daily life outside of structured workouts, standing, walking, manual labor, have higher protein turnover than sedentary individuals. Recovery from injury, illness, or surgery dramatically increases protein demand. Healing tissue requires the raw materials to rebuild, and protein provides those materials. Hospital patients, people recovering from surgery, and those managing chronic illness frequently have protein needs that far exceed standard recommendations. Body composition goals also shift the target. People trying to build muscle need more protein than those maintaining current composition. And during weight loss, higher protein intake helps preserve lean muscle mass as the body loses fat, preventing the loss of metabolically active tissue that makes keeping weight off harder over time. Metabolic and hormonal conditions, including insulin resistance, thyroid dysfunction, and others that affect how the body processes and uses nutrients, can also alter protein requirements in ways that a standard formula cannot capture. High chronic stress, which elevates cortisol and increases muscle protein breakdown, similarly raises needs. Distribution matters as much as total amount. One of the less discussed dimensions of protein intake is timing and distribution across the day. Research consistently shows that muscle protein synthesis, the process by which the body builds and repairs muscle, is maximized when protein intake is spread relatively evenly across meals, rather than concentrated in a single large meal at dinner. The body can effectively use approximately 25 to 40 grams of protein per meal for muscle synthesis, depending on body size and individual factors. Consuming significantly more than this in one sitting does not proportionally increase the benefit, as the body's capacity for immediate protein utilization has limits. This means that someone eating 30 grams of protein at breakfast, 35 at lunch, and 35 at dinner is likely getting more functional benefit from their total daily intake than someone eating 10 grams in the morning, 10 at lunch, and 80 at dinner, even if the total is identical. This is one reason dietitians consistently emphasize building protein into breakfast as a practical priority. Many people's morning meals, centered around toast, fruit, or cereal, provide very little protein, creating a significant gap early in the day that the rest of the day's eating rarely compensates for effectively. Perfection is not the goal. A common pattern in the protein conversation is that people begin tracking their intake, discover they are below their calculated target, and then feel anxious about hitting an exact number every single day. Nutrition specialists consistently push back on this framing. Daily protein intake naturally fluctuates based on appetite, schedule, activity, social eating, and life in general. What matters for long-term health outcomes is the pattern over time, not precision on any individual day. A week of consistently adequate protein intake with some daily variation is far more valuable than perfect adherence on some days and significant deficits on others. The goal is to build sustainable habits that regularly include protein at meals and snacks, using sources you genuinely enjoy and that fit realistically into your life. Starting slow when increasing intake is also sensible, both for digestive comfort and for making changes that actually stick. Jumping from 50 grams per day to 130 grams in a week tends to be uncomfortable and unsustainable. Gradually increasing over several weeks while developing new eating habits creates a more durable pattern. Choosing the right sources. Total protein intake is only part of the picture. The quality and variety of protein sources matters for overall nutritional health. Lean proteins like chicken breast, fish, seafood, and eggs provide complete amino acid profiles with relatively low saturated fat. Legumes, including beans and lentils, provide protein alongside fiber, complex carbohydrates, and phytonutrients that animal proteins do not contain. Greek yogurt, cottage cheese, and tofu round out a diverse protein landscape that serves both muscle health and broader dietary goals. Relying too heavily on processed protein foods or protein bars and shakes at the expense of whole food sources can shortchange the fiber, micronutrient, and phytonutrient intake that a varied diet provides. Supplements and protein products can be useful in specific contexts, but they work best as a complement to whole food protein sources rather than a replacement for them. For anyone with significant health conditions, specific fitness goals, or uncertainty about their individual requirements, working with a registered dietitian provides the most accurate, personalized guidance. The standard formula is a useful starting point, but it is only the beginning of understanding what your body specifically needs.